Welcome back to Learn with Lo, everybody. It is a new week and a new month as we approach May. I'm excited to continue to bring you guys more and more relevant topics that come up through my one-on-one client sessions, in my DMs, just relevant topic items that I feel like require and really are justified by a better platform to really bring to people to have open and honest discussions and really look at it from maybe even more of a different lens as we look through the lens of things like functional medicine, nutrition, lifestyle, movement, as well as how traditional medicine helps us navigate all of these different signs, symptoms of hormones and gut health in the healthcare model as well too. So we spent April really diving into our whole gut health month. We dove into everything from food sensitivities to leaky gut to things like root causes of bloating. We talked about IBS and what we're really gonna dive into, and it's a very much a related tangent, as you guys will recognize today, but we're going to talk about this concept of autoimmunity. It is becoming more and more prevalent in my field and my line of work. Specifically, I have more and more individuals that come in with an active autoimmune diagnosis or a history of autoimmune disease in the family. And there's just a lot of still medical mystery that we're learning about the autoimmune umbrella of different diseases. And even now there's 80 to 100 different recognized syndromes and symptoms and diagnoses that fall under this autoimmunity umbrella. So it's ever more growing in commonality, but there's not as much, I think, resources for these individuals because we're still very much treating it from just a traditional medicine approach or more of a symptom management approach versus really looking at the big picture and asking how autoimmunity develops in the first place and what are some of the different preventative or even palliative type care options that we want to think about in different fields of medicine, whether that's nutrition and gut health, lifestyle strategies, adrenal, thyroid function, all of those things that I work with specifically with my patients on a daily basis to dive into, which is a whole different part of medicine. So when we think about autoimmunity, there's over 23.5 million Americans today that suffer from an autoimmune condition. 80% of those are women. Right? So we'll kind of talk about that as well too. Very shocking statistic for some people to really ask that bigger question of why are women dealing with or seeing more relevance of these autoimmune diseases in that female population. And I think as we get into some of the root causes of autoimmunity, it will make maybe a little bit more sense of why women tend to be a little bit more vulnerable. So when we think about autoimmunity, when I see in my practice these hormonal imbalance symptoms, gut health concerns, a lot of times they accompany an autoimmune diagnosis. So a lot of individuals, though, aren't necessarily putting two and two together. They still have that mindset or that understanding that their autoimmune disease is this completely separate entity of their health or a completely separate label of their health. But I'm also dealing with the fatigue. I'm dealing with the chronic constipation. I'm dealing with bloating. I'm dealing with low libido. I'm dealing with insomnia. I'm dealing with weight changes, cravings, yada, yada, yada. And they're not necessarily connecting these two worlds together. I was listening to a podcast this weekend and I loved the quote that I heard from this specific podcaster and interviewer, and he really was talking about the analogy of autoimmunity being a fire, right? So when we think about it, the fire starts before the alarm goes off. I love that quote because a lot of times if we're in tune with our environment, and we stick to this analogy, we can smell the smoke or feel the heat before the fire alarm goes off, right? But a lot of us are so disassociated from our bodies and disassociated from our environments that we ignore a lot of the early signs and symptoms of our body trying to communicate with us that like, hey, something inside here, it's not right. I'm having to make all these sorts of compensations just to keep you upright on a daily basis. we're making things work right now, but if we could make some changes, that would be great, because the system is about ready to burn out. We are running on all cylinders, and it's only a matter of time before we're run out of resources and we're going to hit rock bottom, right? That's usually where autoimmune conditions tend to originate from. So when we think about autoimmunity, it's not this separate entity, it's not this separate label. A lot of times, some of the early signs and symptoms of autoimmune conditions are ones that we tend to overlook or ignore. We chalk it up as like, oh, it's all in your head, or oh, it's just because of stress, you need to manage your stress, or it's just a normal part of being a woman or being a parent, right? All of these different things. And for better or for worse, a lot of times traditional medicine and even society kind of normalizes these symptoms, so we then ignore them, and instead of doing something about them up front, they turn into a bigger and bigger problem, which is why I think we're seeing such a prevalence of autoimmunity, is because our genetics, our environment, our lifestyle, our stressors, our nutrition, everything's really creating this perfect storm where our body is 100% overloaded and it can't do anything but start to set off the alarms, right? So it's just this fire that I want to teach you guys along the lines of that same analogy. I want to teach you guys, how do I recognize the smoke and how do I feel the heat of a fire that is burning before all of the alarms go off. So starting to recognize things like chronic fatigue, joint pain, muscle pain, anxiety, depression, digestive issues, food sensitivity, insomnia, blood sugar imbalances. All of these types of things really come on years before these types of things can potentially progress. So many of us are living intentionally or unintentionally in this kind of like fight or flight system, almost overloaded all of the time, but we cover up or we push these symptoms aside until they're really too big to ignore. So that's really what's going to bring us to this autoimmunity conversation today. And you'll hear a lot more detail around that as well too. But it gives us a little bit of light into why there's probably so much prevalence and why the prevalence is very much skewed in the direction towards the female population as well too. So let's really set some groundwork here. What is an autoimmune condition? What is autoimmune disease? So there's still much being studied about autoimmune conditions. So don't think that anybody, any medical professional out there that claims to have it all figured out, they probably don't, because they're learning right along as science is available to them as well too. But the traditional medicine understanding of our autoimmune conditions is the immune system mistaking friend from foe. That's the job of the immune system, is to really sample, right, to get a taste of all of the different things in our body that come in inside the body, that come in from outside the body, and distinguish it as like, is that natural? Is that a friend to us? Do we digest and absorb that and assimilate that? Or is that a foe? Do we tag that with an immune antigen and then send our army in to really get rid of it, right? Our kill squad. So the immune system then, it ends up being an autoimmune condition is an issue with the immune system sensing that friend from foe. Now, what happens then is an immune system becomes kind of hyper vigilant, and it's accidentally tagging things that actually are friend as foe. And that's where we start to get some inside tissue destruction. And a lot of times the traditional understanding is that our body is attacking us from the inside out. I don't think that that's a complete misnomer, but I also think that's a little bit egregious to think that our body would somehow turn on us for no good reason. It's like, no, our body is probably trying to protect us from something. We need to have a bigger picture, bigger ask, why? Why is the body doing this? It must have some reason for it. Where do we want to kind of trace things back a little bit? So when we think about different autoimmune conditions, again, there's 80 to 100 of them. So there's no way we're going to be able to talk about all of them today. But since they all fall under this autoimmune umbrella, there's a lot of commonality to their root cause origins, right? Which is what we'll talk about. So when we think about the immune system, again, it's mistaking and tagging friend from foe. So it's an immune system disorder, right? We need to recognize that first and foremost, that all these autoimmune conditions go back to the immune system, which is housed in the gut, right? So it's like, oh, okay, I see where you're going here, Lauren. There's an immune system component with a downstream fallout, right? So there's some sort of organ or tissue or system that the immune system is picking on that's choosing to tag it as foe, even though it's friend. And so then we get a downstream fallout or downstream tissue destruction. So when we think about all of these, it's like, oh, so Hashimoto's is when the immune system attacks the thyroid. Yes, exactly. Or something like rheumatoid arthritis is the immune system going after the joints. Yes. Things like multiple sclerosis, the immune system going after the central nervous system. Fibromyalgia is the immune system going after nerve cells. Type 1 diabetes is the immune system going after the beta cells of the pancreas. Psoriasis is the immune system going after the skin. Condition called Sojourns is the immune system going after things like lacrimal and salivary glands, so like your tear ducts, and some of your glands within the mouth and causing swelling. Things like ulcerative colitis is the immune system going after the colon, right? We could go on and on and on about, oh, so it's the immune system with a downstream tissue destruction fallout. Now, the hard part is when individuals do get diagnosed with an autoimmune condition, the traditional medicine route is usually more of a Band-Aid solution, right? All we really have equipped for us right now in the traditional medicine world to handle these autoimmune conditions is either an immunosuppressant, right? Which just is like, I don't really know why the immune system is doing that, so let's just like shut it up, right? It's like, meh. But it never really gets us at the root cause, right? Or I think another disservice is we then shuttle these people to various specialists in which the immune system is targeting, right? So it's like, oh, we send Hashimoto's individuals to an endocrinologist. It's like, well, this isn't a thyroid problem. This is an immune system problem. So we go on to treat the thyroid, and it's like, it's not a thyroid problem. Or we send, individuals with things like MS to a neurologist, and it's like, well, it's not a brain issue, we have an immune system issue here, right? It's going to have to be an integrated response. I'm not saying that those specialists aren't necessary. 1,000% they are. Thank bless for what they do. But it has to be an integrative medical team here where these individuals are also utilizing and recognizing like, okay, 80% of my immune system is housed in my gut. How is my nutrition and my lifestyle and my environment and my stress and my hormones exacerbating this symptom? We can absolutely support where we're getting some downstream destruction, but that's not the root cause here. If we want to reverse the downstream tissue destruction, we have to go back to the root. And so that's where I'm super passionate about, and helping people recognize if you're coming in with hormonal imbalance symptoms, you're coming in with gut issues, you're coming in with an autoimmune disease, it's all connected together. And chances are there were a lot of hormonal imbalances and gut issues that were probably the smoke and the heat that you felt long before the fire alarms went off. So now is the time where we're actually going back to the drawing board and looking at some of those underlying pieces that really were never talked about in the first place. So when we think about this autoimmune piece, there is kind of a three-legged stool to this, right? So there's three scenarios that really are present to trigger an autoimmune disease. Number one is going to be a genetics, right? So this is not 100% why someone develops an autoimmune disease, but usually it's present, usually it's there. They're like, oh yeah, my dad had celiac. It's like, yeah. Or, oh, my mom had thyroid issues. It's like, oh yeah. Like sometimes there's a genetic component there, right? That at least sets the tone, or what we call loads the gun. It doesn't shoot the gun, doesn't fire it. That gun could sit there unloaded, no symptoms, no autoimmune flares ever in their life, but the genetics might just be there, right? So number one, genetics. Number two, a trigger. right? This is where the mystery really comes in. It's like, okay, the genetics were there, but what pulled the trigger of that autoimmune flare? Most of the time we're looking at things like toxins. Sometimes, like I said, it's toxins that aren't cleared out. Sometimes it's odd toxins, whether it's like molds and pesticides and all of those types of things that individuals aren't able to clear out. Could be a significant stress trigger. I hear that quite frequently. I'm like, talk to me about what was going on in your life before this diagnosis. And sometimes it can even be a trigger of pregnancy, multiple pregnancies, breastfeeding, being in a depleted state, going through an emotionally stressful time, grief, trauma, stress, right? So we're starting to see all of these different things that it's like, okay, genetics load the gun, some sort of environmental or epigenetic factor pulls the trigger, and then the third leg of the stool is a present leaky gut scenario, right? Or what we call in the functional world intestinal permeability. So that means when we look at our intestine, our small intestine specifically, it's about the thickness of a wet paper towel. That's it. It's very, very thin. One cell layer thick of what's determining like what's in the gut versus what's getting into the bloodstream. The second that something's either in the gut or in the bloodstream, we have immune cells that are sampling that and deciding like what gets through and what does not get through. That's part of that autoimmune response where now all of a sudden the immune system starts to lose control because it's like, there's a leaky gut scenario going on. There's a whole bunch of stuff getting passed through those, my paper towel integrity is tearing, right? A good old Bounty situation. It's like, I didn't use Bounty, like my paper towel is physically tearing. So there's things getting into the bloodstream that I don't want in there. And so the immune system's like tag, right? And kind of gets that hypervigilance about it too. So we have a three-legged stool, genetic predisposition, an epigenetic environmental trigger of some sort, and a presence of a leaky gut. So we inherit 80% of our microbiome from our parents, right? A lot of that is passed down, and the other 20% is developed, right? That's why we tell kids, it's like play in dirt, let them put acorns in their mouth. It's like we want these kids to be exposed to and really build up their immune system. That's also why people, again, promote things like breastfeeding to really pass on and build up an infant's microbiome scenario, right? So really building up that robust immune system so that it's resilient to be able to understand like what's friend and what's foe. Then we really lean on the other side. What's our diet? What's our lifestyle? What's our stress of things that could potentially be kind of pulling this trigger, so to speak, right? So the question to me is, and we'll kind of wrap up and leave you with today is, are you treating your autoimmunity or preventing autoimmunity from being in your future by identifying and correcting your particular triggers? Or are you kind of playing a game of cover up right now, right? So I would say by far and away, the number one thing that I want to leave you guys with is kind of those priorities around like, hey, for those individuals out there that are dealing with personally, or they know a family member that's dealing with an autoimmune condition, either any that I've listed or any that are out there, because like I said, there's hundreds of them now, and I'm sure the list will continue to grow, but they all follow under this autoimmune umbrella. So of course it's going to take a multifaceted and integrative team of professionals to really help these people. But I'm super passionate about making sure that individuals at least realize that resources out there exist to help them get to the root cause of a lot of the gut component of autoimmunity if they truly ever want to reverse these symptoms or this condition. So I know, bold statements that Lo is making today, right? To reverse autoimmunity, but I do truly believe that it's possible. So when we think about what are the priorities for treatment for autoimmunity, again, this is outside of the conventional or traditional medicine conversations. They're going to only be able to really equip and talk about things like immunosuppressants or helpful specialists that are going to help try to slow that downstream tissue destruction. I'm going to take an approach of like, let's go back to the root cause and what are we doing to really correct why this occurred in the first place. Priority number one, again, has to be targeted at removing triggers and then repairing the barriers at the level of the gut. Now, notice that I don't just say one or the other. That's where functional medicine has really failed a lot of these individuals, is because some people come in and they're like, oh yeah, gut protocols, I got to remove triggers. And so they're constantly thinking about eat less of that, cut this out, elimination diet, food sensitivity tests, like all of these types of things. And I'm like, that's fine. I mean, we can talk about nutritional quality and looking at potential things of our diet for sure, but you can't just remove the triggers. You have to also repair the barriers. Same thing on the other end though, you can't repair the barriers without removing the triggers. So a lot of people come in heavy-handed and they're like probiotics and prebiotics and glutamine and even like your slippery elm and your marshmallow root and your mucosal membranes and short chain fatty acids and sun fiber. It's like, cool, people come in and try to do all these fancy things to like repair the barrier, and I'm like, you're like spackling the bullet holes and then punching new bullet holes in the next day, and then spackling them in and then punching new bullet holes. I'm like, you have to do both. You have to recognize, how do I remove the triggers? What are my triggers and how do I remove them? And then how do I repair the barriers? It's a double-edged sword. You can't just do one half of those equation, or do neither of them at all, in my opinion, if you truly want to reverse this. So everything has to be prioritized at removing the triggers, repairing the barriers. Number one being nutrition. You know I'm going to talk about it. You know I'm going to say it, because that's going to be a really, really, really big, solid part of this. Now, it's not necessarily going on these fancy dancy elimination diets, but it is going to be talking about following an anti-inflammatory diet, understanding what whole food sources feel best for this individual, minimizing and eliminating some of your ultra processed foods out there, as well as correcting nutrient deficiencies, and whether that's vitamin, mineral deficiencies, or macro deficiencies, proteins and fibers and fats, and also making sure that we're balancing blood sugar. Nutritionally, those are going to be the big ones that we're going to need to address here, right? So that right there, that's a lot. It's like I could make a whole course just based off of that right there and take 8 weeks to teach somebody all of those types of things, right? The second is going to be supporting drainage and detox. Drainage and detox are going to be the two pathways in which our body understands, how do I package up, but also get rid of potential things in the system that are truly a foe, whether that's a pathogen, bacterial overgrowth, toxins, pesticides, heavy metals, cosmetics, fragrances, all of those types of things, right? So opening and supporting detox pathways, obviously it has to come down to proper food hygiene, proper stomach acid production, correcting malabsorption issues, rebuilding mucosal membranes, supporting gallbladder and bile production, supporting detox pathways through the liver and the skin and the kidneys, getting you pooping every day. Those are the types of things to really be supporting drainage and detox. Number 3 is going to be minimizing environmental toxins. I know I've touched on this a little bit, but looking for, some individuals are more resilient to these than others. You should be able to be exposed to these and clear them out. Nobody is going to live in a toxin-free world. Don't try. Don't make yourself crazy over it. You should have a resilient body to be able to be exposed to these, but also get rid of them. So looking at things like air, water, fragrances, pesticides, plastics, those types of things. You can also start to see why women might be a little bit more of an at-risk or vulnerable category, because women tend to use a lot more of those types of cosmetic products and fragrances and things like that too, which can build up in the system over time if you don't have proper drainage and detox pathways. And then number 4 is going to be regulating your nervous system. What everybody loves to hear. Correcting adrenal fatigue is usually a big part of an autoimmunity picture. The adrenals are burnt out from running years after years. Correcting circadian rhythm, putting yourself into a mindset of healing. This may require other professionals looking into things like therapy or trauma work as well. So you can start to see how this autoimmune picture, it's not just one thing. It's a series of things, which is great because we know how we got there, so we know how we can work our way out of it. And I think that is truly my passion, is to help people recognize what are some of the aspects that traditional medicine isn't talking about, but can be very, very strong therapeutic interventions and honestly nutrition, lifestyle, movement, gut health prescriptions that are just as powerful as those that are helping individuals mitigate symptoms and really have a better quality of life with an autoimmune condition as well too. So hopefully that really kind of set the tone for some of the fun stuff that we'll be talking about in May. We're going to be getting a lot into some of this, again, deeper talk about how does one get into this autoimmune situation, what are things like some of this adrenal dysfunction, HPA axis, how do we really support the body overall. So stay tuned for more details around that. If you yourself are struggling with an autoimmune condition or you know somebody who is, I ask that you please share this with those individuals. I want to get this word out, not only just for me personally, but for any of my fellow practitioners that are out here doing some of that same and similar work. If you're interested in diving into more information or more consulting services for your particular scenario, head over to the link in my bio. You can always click to work with me one-on-one there. There's an application link for that, as well as keep on the nose for any of my upcoming courses as well too. So enjoy the rest of your Monday, and we'll be back next week for more Learn with Lo.